Hello, my name is Paul Fischer. I am a graduate student at the University of Memphis School of Public Health, and this is my master's project. I am currently preparing to do a project on mobile points of distribution, or MPOD for short. You may be wondering, what is an MPOD? Much less, what is an open pod or a closed pod? Well, to the beginning, an open pod is managed by a local health department. And it's what we allow the community to have areas so they will come and get medication in response to a pandemic or a bioterrorism outbreak. Whereas a closed pod is something set up by a business due to large numbers of personnel and staff and faculty. And they, as part of their company's response, will provide a means to get medication to their people as well as their respective families. Most major colleges have a closed pod already set up, and it's in conjunction with the local health department's open pod. Now, the purpose of my master's project is to determine the feasibility of an MPOD, and that is a mobile point of distribution, with a key emphasis on the word mobile. In other words, to be able to vaccinate and immunize approximately 150 to 200 citizens within a given neighborhood or community in a very short period of time, approximately about 2 hours, plus or minus 10 to 12 minutes. My goal with this project is I want to determine how many personnel would you need to actually be able to set up an MPOD effectively. With large struggles during these chaotic periods of time is critical. Importantly, vaccinating the community in a quick and as efficient manner is even more critical. The goal in public health is to get approximately 7% of the community vaccinated to what we call herd immunity levels. And what that means is that you have about 70% of the communities been vaccinated, and for the most part that will generally stop or control a spread of an outbreak or disease. Now, that's what the purpose of this project is to do, is provide one tool or one more tool to an incident commander to be able to send out to areas that may be isolated and that for whatever reason are unable to get to an open pod site. And that's where my master's project comes into, and it comes with several goals. I know these are goals were posted on my Indiegogo page, and bear with me as I read them briefly. There are pretty much 4 goals I have set for this project. First is I want to see, is it feasible to even use an MPOD to help manage a pandemic or a bioterrorism attack? Secondly, can we also be able to do it and free up critically needed personnel to respond to other aspects of the attack? Third, I want to create a model that can be replicated by other health departments or even businesses that are considering doing an MPOD themselves. There's only one health department that's used an MPOD, and that's the Miami Metro-Dade, and they used it during the H1N1 problem several years ago. And then finally, using a combination of drills, using what we call REALOPT, R-E-A-L-O-P-T, it's a computer simulation program that the health departments use. You want to determine the number of personnel that's feasible to make this situation work. And that's not just the drill simulations I want to do with this project, but I actually want to do it on a real active drill. And part of this is I'd like to work with the Shelby County Health Department, potentially, during their upcoming flu vaccination programs in the upcoming fall. And that is to actually use the MPOD and have it tested when they're doing their open pod. And that's part of the why I'm doing this project, the way I'm doing it early. Typically this project would start in the spring of a school semester. I'm starting mine, as you can see, this summer. Now the one question is, what makes you uniquely qualified to be able to develop an MPOD? Well, that's a good question. As you can pretty well tell by my vest, I'm wearing silver wings. These are my enlisted aviation warfare specialist wings. I am a retired United States Navy hospital corpsman, spent 20 years in military service to my country. And one of the things that we trained for was dealing with and responding to pandemic or bioterrorism events as part of what we call CBR, chemical, biological, and radiological warfare. And that's where I got the idea several years ago of maybe coming up with a mobile pod. So this isn't something that's new to me. This is something that I've dealt with from an emergency medical perspective for many years. But now I want to take it to the next level and make it as part of my master's project. As you can also see by my Indiegogo page, that there is an ambulance that's there. Yes, the ambulance is real. Yes, it's currently active, and yes, I bought it. I bought it as the base vehicle for this project, specifically to use for the mobile pod. To be able to see, can it even be functional and can it even work? Yes, the lights work, the sirens work. It's pretty much a fully functional ambulance. It has about 89,000 miles. Ideal and set up with the proper cabinet space designed for the mobile pod that I currently envision. Now, along with this, people may be wondering, well, why do we want to contribute when there are other means and funding sources to be able to develop public health responses and protocols? And that's also a very good question. And one of it is that there is scarce research dollars available, particularly those through the CDC and the federal government. Likewise, people may not know where they can invest or even want to contribute to a project. There are many public health projects that students would like to do, but funding isn't there for them. And this, to me, is part of my master's project, is to include in the research and the write-up how I funded this particular project. Likewise, those that contribute, your contributions will be mentioned within the paper. And that's one of those things with this particular project, is ultimately there will be a written protocol. It will determine if it's feasible not to do it, and there will be a full write-up on this particular project. And this is what gives you, the community, an opportunity to invest in the research, to see, hey, see how it goes from conception through actual deployment. Now, likewise, there's only the one question is, what's in it for me? What kind of bang do I get for my buck? Well, that's a really good question. And as you can tell by my Indiegogo page, that there are several perks, everything ranging from $10 to $250. The lowest level I put was $10, and you receive a handwritten note from me. Again, handwritten notes most folks have forgotten how to do. I never did. At $50, you receive a handwritten note plus a school decal, from the University of Memphis. For $100, you receive a handwritten note and a school T-shirt. Please, if you do want for the T-shirt, please let me know what your size is so I can get you the appropriate size. And then finally, for the $250 level, you get a handwritten note, a first aid kit for your own home or your automobile, as well as a school T-shirt. Again, these are my ways of saying thank you for believing in me, as well as believing in my project. Now, once all is said and done, there is a research paper that will be written and created, along with the appropriate research, as well as the proper notes, noted and source citation. Basically, I'm looking at about a 25+ page paper, not counting the appendixes. I've already started my research. I know what the literature is currently reading. I'm currently close to over 50 sources of information that I'm currently going through this summer. For those of you that are interested in a copy of this upon completion in the spring 2013 school year, I will definitely be more than happy to send you a copy of it. Again, you need to see where your money is being invested. So the cost of the project, the $4,500 I'm requesting, is to help pay for the expenses that I have not been able to pay for. As I mentioned before, the ambulance that you see is on the profile page. It's real. I've invested into it. I bought the ambulance outright. It belongs to me. But likewise, there are still supplies in there that I do not have that I definitely need. Things such as a refrigerator to handle medications. Things to handle supplies such as vests, traffic cones, of course, appropriate signage. These are things that needs to make a mobile pod effective, as well as efficient for the staff, as well as the people that are going to be using the mobile pod, both those passing out medication and those receiving medications. So with this in mind, I'd like to go ahead and put this in conclusion. If you have any questions, please don't hesitate to ask me. I will be more than happy to answer your questions that you ask, and I'll be upright and forthcoming with them, particularly on how your funds are being spent. In conclusion, I want to thank my family and my friends for their support of me in the last couple of years as I've been going to school. This has been a long road since I retired from the military several years ago, and I appreciate your prayers and your support while I've been going through this. For those of you that have never been considering where to invest in school research projects, this will give you the opportunity to invest within it and to see firsthand how the next generation of public health workers were being prepared to deal with the problems later on as a hopefully worst case scenario. If they should come up, we can respond quickly and effectively. Again, thank you very much for your support. Take care and Godspeed.